Welcome to episode 4 of the Walker's Winners Goal Getters podcast. I am Katrina Walker, the executive director of Walker's Winners. Walker's Winners is a youth development organization that was co-founded by me and my son, Jordan Walker, who is an outfielder for the St. Louis Cardinals. The mission of our organization is to promote the academic achievement, holistic well-being, and personal empowerment of children and youth through programs and partnerships. Our Goal Getters podcast is a key way that we do that because we want to highlight people who are doing remarkable things, who have set stretch goals and met stretch goals, and exemplify what it means to be about academic achievement, holistic well-being, and personal empowerment. So we are really fortunate to have today Dr. Kendra Holmes, who is the president and CEO of Affinia Healthcare in St. Louis, Missouri. So we want to pause and welcome Dr. Holmes to our podcast today.
Thank you. Thank you for having me. I'm excited.
Yes. Okay. All right. Well, let's jump right in. I started by saying that we are a youth development organization. And one of the things that we think is important is that kids, no matter what age they are, they can see where they are and imagine themselves doing some of the remarkable things that people we talk to are doing. So can you tell us about your childhood?
Yes. So I am the youngest of 4 girls. So, there was a lot of chatter growing up in our household, a lot of girl talking. So that was really, I think, a part that was instrumental because I had so many role models. So not only did I have my mother and my father, but I had 3 additional mothers to learn from and to see their challenges, academic and also personally, and to learn from them as well. But they really set, the foundation, not only my mom, also being in education as well, but, all of my sisters graduated from college. So again, just the expectation in the household was that academics and college and a professional career, that was always the goal. That really was the only thing that we all aspired to, was academic excellence.
So sometimes when people have siblings, the wonderful side of it is exactly what you say, which is that they're role models. Sometimes though there can be competition. I'm not sure how close in age you are to your sisters. How do you navigate kind of admiring without that relationship, becoming competitive and more detrimental?
So my oldest sister is 10 years older than me. Then the other one is 5, and then the other one is 4. So they may have had more competition, I think, with themselves because I was kind of like not in that age group with them. Again, so there wasn't much that I felt as far as competition, but there was just, the idea of excellence and not wanting to, be the one that didn't maintain the certain level of excellence. So I don't think it was more so competitive with them, but more so competitive with myself and wanting to make them proud as well.
All right, that's great. I mean, one of the things in our program is something called Be in the C, which is about being around people who support, encourage, and offer some kind of accountability. So I think your point about being surrounded by siblings who are striving made that just the natural default, right? You saw Absolutely. Them doing it. You just assumed, you imagined because you were surrounded by it, that was the natural state of being.
Absolutely, yes.
Okay, well, then let's translate that then to K through 8 education. So what was your attitude towards school? How did you like it? Did you not like it? What happened once you got in the school doors?
So I attended gifted school. So there was some early testing that happened, like maybe in first grade or so. And then I went to a specific school that was for so-called gifted children at the time. And maybe now the term is different, but that's what it was during that time. So it wasn't as challenging as I thought that it would be. So my mother also had me in other academic programs, like science clubs and different academic programs to kind of help or to supplement my education as well. So that was helpful. I would say that I really started liking school in maybe like 6th grade or 6th or 7th grade when it became more challenging.
All right, so there are a couple of things that I heard that I wanted to follow up on. So one, your mom knew that it wasn't challenging you, so found other things that did. And so I
Yes.
want to pause there and ask how your mom was aware and how, she then, what she then was striving to do in the other program she put you in.
So my grades were great, but I was bored. So she could tell that I was bored academically. And I think a lot of children sometimes go through that, and we think that is that they don't want to go to school, but they're not being challenged. So
Mm-hmm.
she really sought out different, reading programs, science programs to kind of again supplement that with me. And I think what she wanted me to do is to not become a student who didn't want to go to school.
Mm-hmm. Mm-hmm.
So she tried to make it challenging in other aspects. But I would say up until fifth grade, like it wasn't a challenge at all. And then
Mm-hmm.
there were actually back then, I don't know if they still do it. They wanted me to skip grades, but
Mm-hmm.
my mother didn't feel that I was mentally at a level to be with, older children. And I can tell you that I wasn't. So I wasn't, I just wasn't mature enough to be with like older children. So that was what she wanted to do to help me.
Okay. So looking back, there's a way that you see yourself where you're like, that wouldn't have worked. So I wonder if you have an idea of what school could have been like to make you more interested in being there.
I think I just needed more challenging work. So I really probably in the third grade, I needed to be doing sixth grade work. And
Mm-hmm.
that would have and the school saw it and they said that's why that they wanted me to skip the grades. But emotionally, maturity wise, I was not at the point where I could be with older children.
Okay. Okay. And then you said that, so we keep coming back to the idea of challenge. And a lot of people sometimes are put off by challenge. And, they would prefer for things to be easy.
Yeah.
Make the case for why challenge can be exciting and like invigorating and make you want to be in a space.
So I'm not sure where I got that from because my other sisters will say that that's not the way that they do things. But I've never liked easy. I've never wanted to do anything that was easy. If there was an option I remember in eighth grade, we had the option of which would be our homeroom teacher. And one teacher was really tough and one wasn't. And no one wanted to be in the tough teachers class, but that's the class that I wanted to be in. And I think that what it does is that when things do become difficult, you've experienced hard, right? So if you have just an easy situation all the time, when hard comes, and hard is going to come, I don't feel that you're often prepared. So I would rather just do difficult as much as possible so I'm prepared when the really difficult comes.
Okay. I feel like high school, you said sixth grade was, you finally started to get challenged, but high school probably is the place where you met hard.
Oh, yeah. Yeah.
Talk to us about that transition to high. Well, kind of tell us how you got into the high school that you made it to, and then kind of what hard looked like there.
So you had to test into my specific high school. I went to Metro Academic Preparatory, and it was again it was a St. Louis public school, but it was classified as a gifted high school. So you had to test into the specific program. I would say that was the most challenging that I've ever experienced. Not necessarily because of the academic piece, but because it was very much like a college campus. There was no hand holding. There was, hey, if you show up for class, you show up for class. If you don't, you just flunk. There was not, it was instant adulthood in ninth grade. And it was instant responsibility in ninth grade. And I go back a little bit to being the youngest of four and being quite sheltered and quite babied for a long period of time. So that was challenging, but I think that I liked that more because again, it was a challenge, and it definitely prepared me for college. Mm-hmm. Absolutely prepares you for college.
Okay. All right. So let's take the academic side piece, academic piece first. In it, you said that it was, I mean, you had to test into it, so you would expect that there
Mm-hmm.
is some academic challenge. How did the academic challenge at Metro High compare to the challenge that you had faced when in middle school and, once things started to become more
So
academic?
we took trig freshman year. So we were at calculus too by, junior year. So all of the classes were advanced. There was no general, I don't even know if is there a general algebra? Like we never, there was no plain out. You were always, trig, calculus. So the classes were definitely different. So that was more challenging. And there was a lot of writing. There was a lot of papers, and back then there was no AI. So this you had to think and actually research and go to the library.
Mm-hmm.
So it was really like a college, almost like a grad school level of education in high school.
Okay, yes. If you're getting the calculus two,
Yeah.
then that is an excellent. And so, did Metro High School was that focused on STEM, like the sciences, or all across the board? There was that
It was
level.
we had really no sports or anything of that nature. We may have had a little bit of basketball or something, but our focus was completely academics.
Okay, all right. And then, were there APs there as well?
Yes. Yeah.
Okay. And so, how many AP courses and was
Oh my
did
gosh.
I can't even count.
I can't even count. And so UMSO is University of Missouri St. Louis. So back then we had what was called a bridge program, where many of the students graduated with an associate's degree. When they were graduating from high school. So lots of AP classes, lots of opportunities for internships. That was something that I think was also really important because there was exposure to corporate America in ninth grade. And I know
Mm,
many students back then that wasn't an option. But
mm,
because these students were classified as the elites of the elites in St. Louis, there was interest from different corporations and different organizations, and those resources were brought to those students. And, back then I was like, this is great. But now I look at it and I was like, perhaps those resources should have been to those children who had more challenges. But
mm,
that's often how life is.
mm,
Those who are considered the more elite get the additional resources when the others are the ones who actually need the resources.
mm. Well, we'll talk then a little bit about the demographics of your high school.
So it was 50-50. So it was black and white, but it was a very interesting dynamic because if you lived in St. Louis City, if you were a black person who lived in St. Louis City, you could attend. But to attend for a white student, they had to live in St. Louis County. So, and I'm not sure if it's still like that, but there was an attempt to kind of merge different demographics in the school. So there was an attempt to have, to make sure that it was equitable as far as city and county and black and white. So it was definitely a 50-50 mix.
Okay, and in terms of how students did in the school, did you
Mm-hmm.
find that all demographics achieved in the school?
Um, I think most black people actually achieved a little bit more at the school. And I'm
Mm-hmm.
not really sure why. And it might have been that the leadership of the school was black. So
Mm-hmm.
it was a program that focused on blackness and empowering black students.
Mm-hmm.
So that it might have been more of a culture piece that some of the white students decided to go to their county schools, or some kids wanted to play sports, so they might have
Mm-hmm.
gone, and that just wasn't a focus at Metro at the time.
Mm-hmm. And then talk about, because I know you said that because it was an open campus,
Mm-hmm.
when we've talked before about your high school, that that a lot of people had difficulty going to class and staying on campus. So when you talk about those who started in your class versus those who graduated,
Yeah.
talk about that.
So for when I entered in ninth grade, there were 100 freshmen. We graduated about 25. So yeah, it was you just had to keep up. No one was holding your hand. No one, you were skipping. No one was calling your parents saying you're skipping. You just got your report card and you had F's, and then you were kicked out. And that's how I was. And I'm sure it's different now, because, that wouldn't have been a politically correct way of doing things now. But it was very competitive. I mentioned before that there was a list of your ACT scores by name on the wall. Everyone knew who got what on their ACTs. Very, very competitive, a very competitive environment.
Okay. Is it an environment in which you think students felt supported?
To a certain extent, it depends on what kind of support you needed. So if you needed some academic support, there was limited tutoring, available. There was some tutoring available. Now, as far as, if there were issues at home, food insecurity, those type of social determinants of health, there was a lot of support for that. But with academics, you were expected to excel, and you knew coming in that was the goal and that was the expectation. And if you didn't meet the expectation, you didn't stay.
Okay. All right. Well, then we've graduated now from high school and we're headed to college. Tell me what the next step from high school was for you.
The next step is ninth grade. I was accepted to lots of colleges, but I chose the University of Health Sciences and Pharmacy, St. Louis College of Pharmacy, to be a pharmacist. And that actually is in St. Louis. It was not far from where I grew up. Now, if you want to talk about demographics there were, probably when I first entered there were maybe 20 Black people out of the entire school of like 1,000. So there were no Black professors, no Black educators. So a very, very non-diverse environment. A lot of the classes I had already taken. So, some people were taking like general math, and I don't even know what general math, but like whatever that is. And again, I was already in calculus. There were tests, so I tested out of the communications, the basic classes. I tested out of all of those. So that really gave me an edge to kind of just start chipping away with all of the harder classes and going faster into the actual pharmaceutical curriculum. So that was good. I always loved organic chemistry. Organic chemistry is...
I just really have to pause. You are the first person I've met who said, I loved organic chemistry. Usually that's the class that broke me. That's the class I had to get through if I wanted to be a doctor. So I just want to soak up that I've met someone who loves organic chemistry.
I don't know if you can see behind me, but I have a periodic table as arts in my office. You're like, yeah, she's crazy. But
that's awesome. I love it.
Yeah. So organic chemistry. I don't know. I've always loved organic chemistry. I took it in high school, and I actually became a tutor in college for organic chemistry my first year in college. So definitely my high school prepared me for college.
And that's the first time I've heard of organic chemistry being offered in high school. I mean, okay, Cal 2 told me something. Organic chemistry tells me something else. And for a minute, for people who've heard it as this thing to be feared, as a person who loves it, what is what are the things that you love about organic chemistry?
I love the equations. I love solving the equations. Like I always say, like people try to make things so hard for you. Like I do organic chemistry problems for fun. Like you really can't do anything that's hard for me. Like you can't make it any harder in life for me.
Mm-hmm.
So I think kind of goes back to what we were discussing with not wanting to do easy things and wanting to be challenged. Like if you can solve some of those organic chemistry problems, like you just feel like you're the smartest person in the world, right?
Mm. I like the point you're making too about challenge. Like a lot of people step back from it because they fear maybe that they'll prove themselves unequal to it.
Mm,
But the flip side of it is the confidence that comes,
it
the
does.
affirmation that comes when you've done something hard successfully.
Mm-hmm.
And so, what you've just said about solving organic chemistry problems, you're like, nothing is hard after this, and it might take you a while to solve them if they're as complex, and being okay with that, right? That just because it takes longer doesn't mean it can't get done,
Absolutely.
and that when you solve it, not if you solve it, you'll have this deeper sense of confidence about your capability.
Absolutely. Yes.
Mhm. Okay, all right. So we paused at organic chemistry because we were wild, and then can you tell us more? Because what people may not know is that this program is a 7-year
Yes.
program,
7.
and through it you'll get your doctorate. So you get both your BS, I guess, and your doctorate. And so,
Mhm.
can you quickly overview for people typically how those 7 years go?
So for the first 2 years, it's kind of the basics. If you test into the basics, so your algebra, your general chemistry, biology, and then you kind of work your way up to the harder sciences. But the first 2 to 3 years, depending on how fast you can get through it, is just really kind of the basics to get your bachelor's. But
Mm-hmm.
then, like for the third through fifth year, that is the pharmaceutical piece. So that's when you're doing therapeutics, when you're doing pharmacokinetics, biology, specific biopharmacokinesis, those specifics that are related to medicine, pharmacy, also anatomy and physiology. So all that huge medical piece and therapeutics and pharmacology, getting to know every drug class, every function of the human body, all that great, fun, interesting things.
All right, and you're using some words that I kind of know what they mean, but I'm not quite sure. So, pharmacology is the study of how chemicals and drugs interact in the body. Is that?
Yes.
And
Yes.
then therapeutics. Can you just give us the plain
So
language?
therapeutics are just really how which drug categories work for specific illnesses. So the therapeutics of hypertension. So do you use a calcium channel blocker? Do you use a beta blocker? So that specifics how the therapies work for those specific illnesses, those specific chronic diseases. And then
Mm-hmm.
the kinetics pieces, it's all related to peaks and troughs of how the medicine comes into your body, how it peaks, how it dissipates, how it's eliminated, processed through the liver or the kidneys.
Okay, because when I think kinetics, I think movement. And so,
So
is it have something to do with how it's moving through
how
your
it's
body
moving
and
and
how it's
peaking.
impacting different
Yes,
organs in your body?
yes,
Okay.
yes.
Okay. All right. That's helpful. All right. So that was year 3 through 5, and now we got 6 and 7.
So that is when you are doing clinicals. So you have a specific hospital clinicals, inpatient clinicals, pharmacology clinicals, and that goes back to my liking to be challenged. So you could try to get away with some easy ones, like you can do like a retail pharmacy clinicals or things like that. But I chose some really hard ones. So I chose oncology. I chose bone marrow transplant floor. I did the VA, so Veterans Administration. That was quite challenging. So again, just really tried to challenge myself with the clinicals as well.
Mm. Okay. And can you just overview some of the challenges you experience in those clinicals and what you learned from them?
So the academic challenges or the people challenges? So,
I'll let you. I'll let you tell me.
so academic wise, bone marrow transplants, any type of transplant, that's very complicated. The medicine, the pharmacology of it is very complicated. It's life and death, right? So that was the academic piece. Because you actually are working with the physician, you are helping to choose specific pharmacology, specific guidelines, looking at where they are and where they need to be. So you're actually working and you're being basically evaluated by a physician, and the physician is your preceptor, and they're the ones that are grading you and are going to say if you pass or fail. So that piece was challenging, but you just prepare. The other piece is that there were not a lot of Black pharmacists in St. Louis, especially in clinical settings. A lot of the Black pharmacists tend to be in retail pharmacy or your CVS, your Walgreens, so more of outpatient settings. So when you start to get in that clinical setting, there are a lot few of us. So you get the microaggressions, you get the racism, the implicit bias piece. So that was definitely there as well.
Mm-hmm. So two questions, and one may answer the other. But why do you think there are fewer Black people in clinical, who are clinical pharmacists? Mm-hmm. And then the second is for people who've never experienced the racism or the microaggressions. Mm-hmm. Can you give some examples of what that looks like?
Sure. So I think a lot of the reason is that when you get out of pharmacy school, you may have a lot of debt. So you tend to have to go to a career that pays more. And often the retail pharmacies, the CVS, the Walmarts, they're going to pay more initially than a clinical setting may pay. Also, with the clinical setting, you need a residency. So you have to, an additional, depending on what your specialty is, you may have to do an additional 2 to 3 years. So again, that's 2 or 3 years. If you have a family, if you have student loans, that you're not, actually having an income, a pharmacist income. So I think finances are a big issue. I think another issue is, quite honestly, it's challenging. So, often people, want to go with the easier route. It's challenging. So I think that's part of it. And then it's kind of, this answers your second question, is that they don't necessarily make it easy for us, right? So, they're not necessarily as welcoming in those clinical hospital settings, in those specific roles. So I think that is also a motivator why we don't have as many Black pharmacists in those clinical settings as well.
Mm-hmm. All right, and then going to the welcoming, the microaggression, the racism. People like, I don't see it. What are you talking about? So what would some examples be?
I mean, just if there were 2 students on a rotation, you just kind of clearly see who the preceptor may gravitate to, or who they may, ask them the question first, and then you're the second person to answer, or the questions for you are more in depth than they are for the other individual, or even things like, when patients are being selected, always been given the Black patient instead of the white patient, which that's completely fine for me. But just, the things like that. And definitely, this kind of belief that, how did you get here, right? Like, how could you possibly get to this level?
And of course, they wouldn't come to you and say, how did you get here? So have people come to you and said those words?
I probably would have been in jail, but no. Just it's a lot of questioning. Well, what high school did you go to? Where did you grow up? What did your parents do? That kind of trying to, figure out how could you have possibly gotten here? Is there a DEI program that, got you to this point? Well, and I will say that they may not just outright say that, but a hospital culture is a very white supremacist culture. It is not very welcoming to people of color in most cases. So that's kind of ingrained in that culture. And I've worked at hospitals, and that has been the case for a long time. I mean, hospitals in St. Louis weren't segregated until the 1950s and 1960s. So that history is still there.
Okay, so desegregation, you said, happens
Yeah.
1950s and 60s. Mm-hmm. And so, but these hospitals were desegregated now. So Black people are welcome to come in. Why would you suggest that there's a white supremacist culture? What do you mean? Well, I would imagine people would say, so then, what could you specifically point out that said this is the way in which it exists?
Well, you can just look at the outcomes. You just look at the data. You can look at the data of as far as, Black women in particular with maternal health. You can look at the number of deaths for Black women that are preventable. And when we look at the research and we say it's not based on, their education or their income level, it's based on just implicit bias and not listening to their concerns. And we see that at all levels. If you're an educated person, if you're uneducated, that those disparities still exist. We see those disparities with sickle cell patients and the amount of pain medication that are given to sickle cell patients compared to, white people who may have back pain, because the belief is that, Black people are drug seeking or that we have a higher pain tolerance. So those concepts are still in medicine to this day. Now, medical schools are trying to, do training with implicit bias and things like that. But, there's a lot of work that still needs to occur. And if you just talk to people, right? If I talk to my patients are afraid to go to the hospital. Like, they are so fearful of going to the hospital because they don't feel that they are treated fairly.
Okay. All right. So you say there's quantitative data, there's qualitative data, there is the experience of people that you talk to that all supports the sense of Black people not feeling welcome, or that there is not the resource or the care for their health in the same way.
Absolutely.
Which brings me back to this idea of belonging or affirming, or how the culture is, because you talk about your experience in your PharmD program, and then the experience at high school, and now just the kind of experience perhaps in healthcare. Talk about the importance of being feeling a sense of belonging. I know are feeling seen in different spaces, and how it's important and how you can navigate when it's not there.
So first, I think you have to have a strong sense of self. And how that's developed. I often say that people get their confidence from their mothers. And I've noticed that in life, that when you're a confident person, generally your mother is a confident person. So I always just say with raising children to just try to instill that confidence in them, because the world will try to take that confidence from them. So I think the home piece is number one, just having some solid sense of self from the beginning. And then knowing who you are is the other piece. When I was in pharmacy school, there were other, of course, black students that started with me. And they had, I believe, a more challenging time because they felt the need to belong in an environment that wasn't welcoming. And when you put yourself in that situation, I think that, it's stressful for you, not only the academic piece, but also that personal level. And that makes you maybe not excel academically. So in those situations, I would suggest having a strong family or friend base that you can belong to. Because often you won't belong, often you won't be welcomed. And that's just the honest truth, right? Sometimes you're not welcome. So you have to be comfortable not being welcome. You have to be comfortable not being invited to lunch. And you need to be comfortable if you have to sit, and eat lunch by yourself. I know what I would always do is, this is a thing that Black people have that I think, like I can be somewhere and I'm the only Black person. I see one of the servers and we instantly bond just by looking at each other.
Mm-hmm.
So I have that, that bonding with Black people in general. But I think you just have to be comfortable not being welcomed. And that's challenging for some people to understand, especially younger people now, because I feel that they think that we're so far away from racism and we're far away from, segregation, that they feel that they should just be welcome and that's just how it should be. And we're not that far away from it.
Mm-hmm. Mm-hmm. Okay. All right. And I see how it operates in an educational setting, right? And the importance of the sense of self and knowing who you are and finding some kind of community, be it family, friends. Mm-hmm. Now we're translating that to a patient who needs to seek healthcare. Mm-hmm. How do you navigate a system where you feel that you're not welcome and that your needs are not being attended to?
You have to advocate for yourself. And that's something that is challenging for a lot of people because there's this concept that the doctor knows everything and you don't want to challenge the doctor, or you don't want to say, hey, I don't think that's the right therapy for me because the doctor is all knowing. And you have to advocate. So what we do at Affinia Healthcare is we make it very easy for patients to complain. And because if I'm doing something wrong, I want you to tell me so that I can correct it. So we have on our website, when you walk in the door, if there's an issue, this is how you complain. When you register, there's a sign, there's a form that says, this is how you contact not just me, federal regulatory bodies, right? Like this is how you contact the Joint Commission if you're noticing that the area is not clean or there are issues. So we have to find those channels where we can complain and we can say that, you know what, I wasn't treated properly. The doctor, when I came in, they never even looked me in the eye. They never asked, we have to advocate for ourselves. And if you're a person who can't do that, bring someone with you. I tell people all the time, if you go to a doctor's appointment, bring someone with you that can advocate for you. If you are in the hospital, please have someone else that's a second pair of eyes to see what's going on, because we absolutely need that in healthcare.
Okay, that makes sense. And I love the point you're saying about advocacy and having another person who can see. Yeah. But it seems like another key thing is even knowing what to look for, right? If you your whole life have gone to doctors and they've never looked you in the eye, you might just think that's how they behave, right? And how would you know that there's a better course of treatment for you if you don't know the options? So what recommendations do you have for people to educate themselves about what they should expect from their healthcare providers and just maybe what treatment options they have?
So there's a lot of information out there and you can get overwhelmed with information. So what I generally recommend is that, do some research, do some basic research. Say, for instance, you're diagnosed with diabetes. There's a lot of information about diabetes out there. There are lots of different drugs. You might not get into the information of what insulin is right for you. But just do some basic research on diabetes, how you can prevent those long-term complications. So just get some basic information. But once you're in the doctor's office, you have a right to say, okay, this is why are you choosing this therapy for me? How, based on, whatever my outcomes are, where I am currently, why is this the medication that is right for me? And then you should also set your own goals. So what we do is we do self-management goals for our patients, because I can tell a patient to take this blood pressure medicine and stop, don't eat any more pork and don't drink any more soda. But if they're not going to do it, there is no point of even recommending it. So we say, what do you think your goals are. What can you live with? What amount of sodas a day can you live with? What amount of going and eating fried food can you live with? And let's work on getting to that goal. Let's get there first before we say no more soda, no more cakes and pies, because it's not realistic and you're not going to meet those goals. So we work with the patient to meet their healthcare goals. And that's what every doctor should be doing. You shouldn't just come into a doctor and they look at you and they say, this is your medicine, have a good day. It should be a shared experience where you're telling them, this is where I am in my healthcare journey. How can you get me to where I need to be? On my terms, on my terms as the patient.
Okay. I like what you're saying, both in terms of ownership of it, right? I'm setting goals, and the empowerment, because there's something about being able to ask the question like, why? And then expecting the answer like how and why. That is, you should explain it to me. I'm owed that, and I'm a partner in this, process, as opposed to just somebody who sits passively and receives, something from on high down to me. So there's the empowerment that comes from being able to ask questions, and also being recognized for where they are and the goals that they need to set. Okay. Well, let's back up a little bit and talk about how you got to Affinia then. So now you graduate from PharmD, and then what are your options? What do you choose?
So my option was always going to be in an underserved community. Regardless how much money I was going to make, I always knew that I was going to be in an underserved Black community. And that was the only place I wanted to be. So I didn't look in affluent areas. I didn't look to go in anywhere but in the community that I grew up in, that I lived in. So the options were, community pharmacy, working as like a retail pharmacist. That was never an option for me. I had to work as a retail pharmacist intern to get hours in order to get your license. So I did that throughout school. But I just didn't feel that there was a way to really connect with patients in a community setting. There are some opportunities, but I needed more time to just kind of get additional time with patients to help them. So I didn't want to work retail pharmacy. So I initially started working at it was called the Medicine Shop, and it was in an underserved community. It was like 3 minutes from where I am now. And I was working there, and I've always had an interest in helping the unhoused. So I was working with a priest on providing medications for unhoused populations in downtown St. Louis. And the priest actually told me he was like, there is an organization called Grace Hill. So Affinia was then called Grace Hill, and they're looking for a pharmacist. And he said they've been looking for a pharmacist for like 5 years, and no one wants to work there. And so I hadn't heard of Grace Hill. I was more centrally located where I grew up, and this was kind of more north. So I went to visit. I saw the job application. I went to visit, and in a very impoverished area of St. Louis, and the pharmacy was actually in a house. It was a house. It was an old historic home, and but not renovated. And the pharmacy was in the kitchen, and there was just like wood boards that were our counting tables. It was
pretty basic.
It was worse than basic. And then the prescription bottles were just in totes, and they were just all thrown together. And you just had to go and I was like, okay, well, I know no one wants to work here. But the other reason was that no one wanted to work with that community. So I was like, okay. So I interviewed, and they were like, you sure you want to work?
Wow, that doesn't help. Like when the people who are interviewing you say, are you sure you want to work here? That doesn't
you sure you want to work here? And I'm like, yeah, I want to work here. And so that was, and I've been here for 23 years. And I think what really stuck out to me is that I just felt that they deserve better. Like these totes, the medications were expired. They're giving people expired medicine. Oh yeah, I mean it was it was bad because they were using contracted pharmacists. So these were just pharmacists who were coming in from an agency. They didn't care. They had no vested interest in those people in the community. So they were just getting paid and not doing a good job. And I totally transformed the little house, and we got the medications all in order and not expired. And then we got funding to open a new pharmacy. So I finally had a new pharmacy that was actually clean and didn't have mice. And
worse than basic, you said. Worse than basic.
It was pretty bad. But I fell in love with it. And the other piece that I fell in love with were the patients were so grateful. They were so grateful that someone actually cared, right? Like that someone came and said, you know what, I'm going to make sure you're not getting expired medicine. Like you deserve better than this. And yeah. And again, it just kind of speaks to the injustice in healthcare, that this would have never been allowed if this was a white community. And that's the truth. That it would have never been allowed.
Mm-hmm. And so what would the white community what would they have had that was not afforded to the community that Grace Hill was serving?
So first of all, it wasn't up to code. Like, it wasn't meeting the basic requirements for a pharmacy. You have to have an inventory. You have to ensure that the medications are not expired. You have to have a counseling area. There was no counseling going on, or you have questions about their medication. So it wouldn't have been. It was a safety issue as well. So just the lack of patient safety was also a concern.
So in other words, is there some kind of government entity that should have made sure? And so they just weren't coming by to look to see that. And so if Grace Hill didn't choose to be there, like can you give us a little bit of background on what Grace Hill is? Is it just so we understand? So
initially Grace Hill was a settlement house. So it actually, and this is over 150 years. So they were originally formed for immigrants and refugees, and they really over the years merged into a more social services organization and then a health services organization. So we were a part of the Grace Hill Health Center, and then the social services piece was just Grace Hill Settlement House. So Grace Hill Health Center, when they developed, they had, primary care, dental services, and they had this one little so-called pharmacy, which, was just kind of a makeshift kind of pharmacy, obviously. But absolutely, the Missouri Board of Pharmacy is our governing body for all pharmacies, and they audit, you do annual inspections of pharmacies. So how it was able to stay open is definitely a question. And they might have said, these are circumstances that, they can't find a pharmacist and we don't want them to not have the medication. But there should have been steps in place to ensure the safety of the patients.
Mm-hmm. Mm-hmm. Okay, so you come in, you determined, I want to work in an underserved Black community. Can you just step back and tell us why that was your driving purpose coming out of school?
I think pharmacy school really solidified that. I already had it in me, but just seeing the bias in pharmacy school. Pharmacy is a very white profession. And really seeing that there was really no, and I'm sure it's different now, but there was no really discussion about diversity in pharmacy school, or about, should we just focus on medications that have only been researched in white people? What drugs are more effective in Black people, right? Because there are certain drugs that are more effective in Black people. Blood pressure is a prime example of there are certain medications that are more effective for Black people. And I didn't get that from pharmacy school. I didn't get, how can I help underserved communities. How can we focus on, the diabetes disparities, the hypertension disparities in African American communities? That piece was completely missing, and I felt that it was intentionally missing. So kind of going back to how my mother did me, I had to go out and find other information to supplement my knowledge, because I didn't learn that in pharmacy school. I learned a lot in pharmacy school, but there was no focus on diversity at all. My knowledge from pharmacy school, you would have thought that the only people that I would be taking care of were white people. That that was it. So why I chose to be in an underserved Black community, that was really part of the reason, because there was just, I felt we had no representation. We didn't have any good representation. We didn't have anyone looking out for us.
Okay. All right. And so then you say there is a need that's missing. There's a population intentionally left out of the literature, the research, and the service. And so I want to go to where there's that need. You get to Grace Hill, you start rebuilding, redesigning their pharmacy, and then tell me where you go from there.
So I started as a staff pharmacist. I stayed in the role of staff pharmacist maybe 2 months, and then I was promoted to the director of pharmacy. I stayed in the director of pharmacy role for maybe 4 years. And then we had a new CEO who came in, and he was very forward thinking, and we both shared that there needed to be some changes in the organization and to support additional needs. So there was no lab. We had to take all of the labs outside. Well, when you're in a community, as the community that we serve, you can't expect patients to go down, across town to go to a lab. They don't have the transportation. They don't have the gas money. So you really needed to make it really a one-stop shop. If we really were trying to improve the health outcomes, we need to bring lab in-house. We need to bring radiology and mammography in-house. And that was my vision. And at the time, the CEO agreed with my vision. And so I said, can I do this? I didn't ask to be a vice president. I just said, can I focus on bringing the lab in-house? Because it directly impacted pharmacy, right? Like, how can we give you medication and we don't know if it's working because we don't have the labs back to tell if it's working or not? So one of my first projects were bringing the labs into then Graceville Health Center. So I set up 6 labs. And then once I did that, then that's when everybody starts asking you to do more things. So that's kind of how life is. Like, once you do something, then people were like, oh, well, you did that. You want to do this? So then the next one was radiology. And now I'm a pharmacist, so I know labs, but radiology wasn't something that, I knew about radiology equipment and different, aspects of that. But there was a need. So I researched it. And back then there was no AI. So, I researched it. I reached out to colleagues at WashU and Mallinckrodt, and was able to bring radiology in and bring mammography services in-house as well. So then I think at that point, the leadership was like, okay, maybe we need to have her in leadership. She can kind of get things done. So I was at that point promoted to, it's been so many promotions. It was director. First, it was director of pharmacy. Then it was director of pharmacy and lab. Then it was director of pharmacy, lab, and radiology. Then it was vice president of all of ancillary services. Then it was vice president, chief operating officer. And then it was senior executive, chief operating officer, and then CEO.
Okay, I just feel like I actually need more than one conversation. There's so many things that you talk about. We'll try to contain it so that we're not here 2 hours. But just for a little piece, though, when you keep talking about leadership, research coming up. So as an English teacher, I do just want to shout out a lot of students may feel like my research days are over once I leave school, but research,
Mhm.
particularly as you prepare yourself to move into new areas, continues
Mhm.
to be an important part of life. So we'll just tuck that away. Research is important. Research
Mhm.
skills are key. I want to instead talk a little bit more about leadership.
Okay.
And as you take on these projects, what kind of skills were you drawing on? How were you able to be effective at getting these new projects implemented?
I was effective, and I am effective because I I listen to the staff and I listen to the patients. So my trajectory, I don't think would have happened as fast or even happened if I wasn't first a staff person. So I was there with the staff, frontline, filling prescriptions, working with patients, understanding the problems and the issues of the organization at a frontline worker perspective. So I will say this that, and I give a lot of credit to Black women, not because I'm a Black woman, but a lot of Black women are in healthcare. And those are the individuals who in this organization really supported and uplifted me and pushed me further. So that piece I think has been, if people ask me this all the time, like what is the secret to the success? I say it's Black women, but it's also being at the ground level. It's at being at the ground level, not always, having to be the vice president, the CEO. I can just go out and talk to people and then say, what are your thoughts? How do you think we should get this done? They know a lot more than me about what they do every day. So focusing on the people who actually do the work has really helped me as far as leadership.
When I hear that, I think about working with, not
Mm-hmm.
above, right?
Mm-hmm.
And that
Mm-hmm.
there's the respect, like talking to the people on the front line, you have the knowledge, and so the respect for what people do, and them seeing you be on the front lines and being
Right.
concerned. And then going back to what we said before about being in the support, the encouragement, right? These group of Black women
Yep.
in particular,
Mm-hmm.
seeing and encouraging and supporting and providing information
Mm-hmm.
that buoyed and lifted, you up to positions where you could impact what was
Right.
happening in the organization.
And just being authentic, like just really
Mm,
being authentic. I say I don't have different voices in different rooms. I don't have different goals in different rooms.
mm,
it's always the same. I think
mm,
people trust authentic people.
mhm,
They know that the answer is not going to change. If I'm in a different
mhm,
room, it's just not going to change. So I think that's helped me as far as leadership. Um, and you know what? I think just being humble. I consider myself a humble person, and I don't have to be the smartest person in the room. I have no problem not being the smartest person in the room. I mean, generally I am, but 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 I don't have any problem. I really gravitate toward intelligent people. Like that's who I want to be around. That's who I'm most comfortable with, like people who have goals and who are doing things like that. I want to be surrounded by that. So I think being able to say if you make a mistake, being able to say I don't know, I'll try to figure it out. I've definitely made mistakes in leadership. I've definitely made choices based on wanting to help someone, and that wasn't the choice that I should have made. um,
mm,
but it's definitely something that every time something happens, I grow from it. I learn from it. And the other part is having thick skin.
mm,
Mhm. The other part is having thick skin because they'll
mm,
love you when they love you, and then when they don't, they hate you, right? And you have to be comfortable being the villain, even when you're not the
mm,
villain.
mm. Easier said than done, that feels like.
You got to do it. I mean, they're gonna make you the villain anyway. So
Mm,
it's a lot of responsibility. I would say that, like, sometimes I don't really feel the responsibility, but when I think about it, I'm like, I'm not just responsible for paying my bills or my household. Like, I have 500 people who have families, who are, depending on me to make sure that I am, financially keeping this organization together, that, so it's a lot of weight.
hmm Okay, so you've talked about the responsibility of being in the
Mm-hmm.
position of president and CEO. That is such an impressive position to be in. Can you tell us what the day to day is like, or help people appreciate what it means to sit at the head of an organization?
So my day to day may be different than another CEO because I'm pretty hands on. And, so I was the chief operating officer. So I have that operations piece that's always a part of my head. The CEO piece is more of the strategy, it's the prioritizing, that piece, the financial piece. But a day to day for me, a lot of meetings with different partners, but I also get every patient complaint, right? So, and
Mhm.
some staff don't like that, but any complaint goes to our compliance department, and I view every patient complaint. So it's analyzing the complaints, is determining, how do we correct it? What are the issues? Are they systems level issues? Are they people related issues? Most are systems level issues, and so then we have to look at our systems. So that is a piece as far as day to day. I'm really big on infection control. So I have a major focus with our infection control committee. So I do review our dental sterilization policies, procedures, our different logs. So reviewing the infection control piece is also a big part of me operational. And then there's the community piece. So I probably go to, my goodness, I probably go to 5 to 6 events a week. So community events, galas, ribbon cuttings, that piece is a large part of my job. The media is a large part as well. So we have lots of interviews, media requests, a lot of panel discussions. That piece is large. And then there's just strategy. So there's focusing on, what is next. So our strategy is determined by our community needs assessment. So we do have a community needs assessment, and those are our priorities for the 3 years. But priorities change, right? So looking at what the need is in the community, like, for instance, this morning I got a call from the St. Louis Housing Authority about two children that actually, one is in critical condition, one actually passed away from starvation in St. Louis City, and wanting us to provide some mental health support to their staff that interacted with the children, and now this tragedy has occurred. So lots of requests from the community about, can we send mental health support? But then now we're also going to go to that housing development and provide some nutrition support and WIC services and food resources to the community, and then, some mental health support as well. So it's just like a constant. There's never a dull day.
Wow. So how many hours a week would you say that you're working?
So I would say I'm in the office generally from like 8 to 4, but then that's after 4 is when the community events start. So, like, depending on when there's a community event. So it just depends. So, like, I think tonight I have a community event. So I have a Juneteenth event that I have to speak at. So it just depends.
And then just briefly going back to the children who were starving, is the lack of access to food
Oh.
that dire in the St. Louis community? Were there other issues of abuse, or really this just reflects the level of hunger that is existing in St. Louis?
So I don't know if there were other issues of abuse, but we are definitely seeing a huge need for food. So there have been a lot of changes recently, federal changes to SNAP benefits. A lot of individuals are no longer or receiving SNAP benefits or food stamp benefits. Work requirements have been now are required for Missouri for food stamps. So they actually have to provide proof of I believe it's 80 hours a month of work or volunteer service, and they have to provide that documentation to the state or they're cut off. So the piece is a lot of people do work, but the burden is that administrative burden of providing the documentation when some people may not have a printer, they may not have a way to submit it. But we are seeing huge issues with food insecurity in St. Louis.
Okay. Thank you for highlighting that, because you hear the news side, but it's important to understand the people side.
Yes.
When kids are starving to death in the city, then that should be something that we care about. Before we close out, just I know that clearly you have a demanding job, but you're also a parent, and so for people who strive to be great at their job and also great parents, can you just talk about how you model or how you manage kind of dealing with both of those?
So I think I've done a really good job of intertwining my personal life and my work. So a lot of the personal things that I'm interested in are related to work. So, or work or just community. So a big focus on, again, like criminal justice reform. So, if I'm doing things with criminal justice reform, I bring my son with me, right? So we do different things together related to health. We do, food distributions, and we volunteer at food pantries. So just having a life that really, what your priorities are shown in not only your work, but in your life. So that makes it a lot easier. So I'm not like, doing something completely different in my personal life that I am in my professional life. I think that helps as well. And just having a schedule. It's a lot easier now that he's in his first year. Well, he just completed his first year of college, but just I go by my schedule. I follow my schedule, and my son is always my priority. So if there's an event and there's something that I have to do for my son is the priority. So just maintaining a schedule is really important. And then the other piece that I have to say is that I have a lot of support. Because some people are like, oh, I just do it on my own and blah, 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 blah. He has a very active father. I have really supportive sisters. I mean, if I call my sister right now and tell her bring me lunch, she's bring me lunch. So I have a really great support system, and that's really how I've been able to do this.
Mm-hmm. So the idea of community keeps coming back, right?
Yeah.
Even when the community maybe didn't exist in the school, there's been family, there have been groups of friends. So finding that group of people who are aligned in the goals and who support, what you're striving, and in that kind of moving authentically so that the things that you're doing in one spot is consistent.
It's consistent.
With things, right, with the things you're doing in other places. And so those are all key. So then obviously you are a person who's accomplished a lot and knows a lot. I'm wondering, has there been advice that you've gotten or, kind of words that you live by that you feel have been really instructive?
So I go back to the humility piece and just like, humble yourself or God will humble you. And I don't want to be humbled by God. So I just remain humble. even when I could say some stuff to some people, I'll just say, just let them have it, Kendra. Just let them have it. But I have really good control over my emotions related to people annoying me. Like, I don't give people the energy that they often want. I just think that when you're calm, you can make better decisions when you're calm. So I just remain calm in just about every situation. And people will be like, they want you to have a reaction. And I just don't give that reaction. I know myself, and I know when I'm annoyed, and I know to just kind of step back and not interact to a certain level.
Mhm.
So I think just being calm and being humble will get you through life, and being nice. I tell people that
Mhm.
all the time. Like, you don't have to be the smartest person in the world, but if you're nice and you're
Mhm.
friendly and you are just kind to people, things generally work out if you're just a nice
Mhm.
person.
Mhm. Well, it certainly has worked out for you in great ways when I think about the impact. And I've just known you for a short amount of time, but it made me want to have a conversation with you when I see the impact that you're having personally within your work, within, the people that you know. Then I think, I see the ways that both your intelligence and the confidence that comes from knowing who you are and what you're capable of, and that humility and the ability to be calm, like how those all show up in making an impact and being nice, right? How important that is.
And smile. I don't, it's just, yeah,
Right, right. It goes a long way.
it really does.
Mhm. So this has been a wonderful conversation. I really
Thank you.
appreciate
Thank
the
you.
time you've taken out of a clearly busy day to have this and to talk about different ways in which goal getting, goal setting. And so the next time we talk, and maybe it can be a final piece, because to sit down with the president and CEO of Affinia Healthcare and not talk about what we can do personally to
Okay.
maintain and promote our own health. Are there some final words you have for us as listeners about how to live our best healthy lives?
So that's a lot. So, but I would say that to advocate for ourselves, because as we get older, things happen. You can be the healthiest person, but things may happen where you have to be exposed to the healthcare system. So it's very important to advocate for yourself, to do some research about what's going on with your body, and your body more than anyone else. I tell people that all the time. Don't let people tell you about your body. You know your body. You know what's going on. You know when something is not right. So just continue to advocate for yourself, and to do the research.
Okay. All right. So we can end on that note. Advocate and do the research, and also remember to be kind, calm, and humble. All
That's
right.
it.
Thank you so much for your time.
Thank you. Have a great weekend.
All right.